Hey everyone, Nicola here from Marryatville Chiro, and I thought we would talk about vitamin D for our Wellness Wednesday health tip. It's sunny, it's summer, but what happens is we kind of shy away from the sun because we're frightened of it and we're concerned about skin cancer and skin issues and all the negatives that are associated with sun. But really, sun is quite good in small doses, and we have to remember it's our best source of getting vitamin D versus an artificial supplement. Our body needs vitamin D from the sun to help us absorb calcium and make our bones stronger. But more research is showing that vitamin D is beyond bone strength. It is something that's essential for improving our immune system. It can play a large factor in respiratory conditions and flu symptoms. It is really important for gum health, oral hygiene, organs, skin, muscles, joint pains, aches and pains. Often I have patients that are just constantly complaining of joint aches and pains, and no matter what we do, we can't get over this hurdle, and their x-rays are coming back clear and we can't come back with a diagnosis, and I refer them for blood work and their vitamin D levels are low. So it's important for your overall health and well-being that we pay attention to these levels. So we need to get everyone outside and into the sunshine, but there's really important factors that you need to understand in order to make sure you're getting the right sunshine. So there's heaps of different radiation from the sun, but the ones we're going to talk about today are UVA and UVB. UVA, they're the bad ones. They're the ones that are associated with skin cancer and skin issues. The UVB, in small, healthy dosage, that's how we get our vitamin D. So we need the UVB rating, and that is generally between about 10:30 and mid-afternoon with a UV index above 3. The other times, and when the UV index is below 3, you're generally getting UVA rays, and that's what we want to avoid. So the main things in order to maximize your absorption is we need to go out in the sun unprotected, so no sunscreen, no covering up, and we need about 50 to 75% of our body exposed, which is heaps. So that's a challenge in itself. You can obviously go out with less exposure, but the less skin you have exposed, the longer you need to be outside for. Now, depending on our skin, so the color of it or how sensitive we are to the sun, that also impacts how long we need to be out in the sun and absorbing our vitamin D. So really, some people need only 10 minutes, some people need up to 2 hours, which is challenging, especially in this harsh Australian sun. So make sure you're taking breaks and you're going in and out of the sun and paying attention to how long you're out there for. As you get older, you'll need more vitamin D. So really, you need to be sort of in and out. You need to be making a conscious effort and not just thinking that because you've walked to the shops for 5 minutes, you're good to go with your vitamin D. So pay attention to it, monitor your levels. If you're having any signs and symptoms that are associated with vitamin D deficiency, talk to your GP. Get your blood levels checked. It's a really easy blood test, and it can make you feel like $1 million when you start getting the right amount of vitamin D in your body. Have a great day, enjoy the sunshine, but be healthy. Take care, and I'll see you next week. Bye.